What causes persistent GSM symptoms in menopause? Imagine feeling uncomfortable every day and wondering why your body just won't bounce back. If you're going through menopause and dealing with ongoing discomfort, you're not alone. Persistent symptoms of Genitourinary Syndrome of Menopause are common and can be quite frustrating. So, what exactly causes these symptoms to stick around? Let's explore the facts. During menopause, estrogen levels drop sharply. Estrogen is a key hormone that keeps the tissues in your vagina, vulva, urethra, and bladder healthy and flexible. When estrogen decreases, these tissues become thinner, drier, and less elastic. This makes them more fragile and prone to irritation, which leads to symptoms like vaginal dryness, burning, and discomfort during sex, or even everyday activities like urinating or wiping. The loss of estrogen also impacts the structure of these tissues. Collagen, which gives tissues strength and elasticity, decreases. As a result, the vaginal walls may narrow and shorten, and the vulvar skin can become atrophic or thin. The pelvic floor muscles, which support your bladder and other organs, weaken over time because of reduced estrogen. This weakening can cause urinary issues like urgency, frequency, or leakage, and can make sexual activity uncomfortable or painful. Another factor is the change in the vaginal environment. When estrogen drops, the amount of glycogen in vaginal cells decreases. Glycogen helps maintain a healthy balance of good bacteria in the vagina. Without enough glycogen, the natural microbiome gets disrupted, and the vaginal pH rises. This creates a more hospitable environment for harmful bacteria, increasing the risk of infections and inflammation that can make symptoms worse. Urinary symptoms are also linked to estrogen loss. The urethra and bladder tissues become fragile and less able to resist infections or maintain normal function. This can lead to recurrent urinary tract infections, burning, and incontinence, which often persist because the tissues do not recover easily without treatment. Certain women are more prone to long-lasting symptoms. Women who have surgical menopause, meaning their ovaries were removed, or those undergoing cancer treatments like chemotherapy or taking medications that block estrogen production, often experience more severe and persistent GSM symptoms. Because these symptoms are caused by ongoing tissue changes from estrogen deficiency, they tend to worsen over time if not treated. Unlike hot flashes that may improve, GSM needs active management. Treatments like local estrogen therapy, non-hormonal moisturizers, and pelvic floor exercises can help restore tissue health and reduce discomfort. Pelvic floor health plays a big role here. When the pelvic muscles weaken, urinary symptoms and sexual discomfort can become more pronounced. Strengthening these muscles through physical therapy or exercises can support tissue health and improve symptoms. In summary, persistent GSM symptoms happen because of the continuous decline in estrogen, which causes structural and functional changes in the genital and urinary tissues. Supporting pelvic floor health and addressing hormonal deficiencies with appropriate treatments can make a real difference in managing these symptoms and improving quality of life.